In many nations of the world, especially low-income nations, if you are living with a disability, many of the people around you believe that you are cursed. This can result in your neglect, abuse, and violence towards you, in discrimination against you. You may not be able to access medical care, education services, employment opportunities, and you may even be murdered in some cases. The World Health Organization estimates that there are 1 billion people in the world living with a disability. Millions of these people are affected by these negative beliefs about the causes of disability. For more than 20 years, Kupenda for the Children has been working to help address these injustices in Kenya. We've been working specifically to help children with disabilities access medical care and education. A couple of years ago, one of the teachers in our programs died when a pastor advised her to stop taking her HIV medicine. We realized that educating pastors needed to be a more central part of our advocacy work for children with disabilities. And upon a deeper look, we saw that many of these negative beliefs were also being perpetrated by traditional healers and Muslim imams in Kenya. So we started to think about ways that we could educate them, and we looked around to see what other people were doing. We saw that there were lots of religious leader training around other health and development topics such as HIV/AIDS and reproductive health, and that these workshops were really working, that religious leaders were making significant change around the health and well-being of people in their communities when they were educated. But nobody had done a disability-specific training for religious leaders. So we created a workshop series. We did one for pastors, one for traditional healers, and we're developing one for imams. These workshops train religious leaders in the medical definitions, causes, and treatments for disability. It also trains them on their legal obligation to care for and protect people with disabilities according to both national and international law. Finally, it helps them develop action plans to go into their communities after the workshop and start eliciting more compassionate responses for people with disabilities and really improving their quality of life. When we realized that these workshops were well received and that they were working, we wanted to quantify them. So we tracked 600 pastors to see what they were doing after our workshops and found that 73% of them did actually go into their communities and make significant positive changes. They started parent support groups, they started disability outreach ministries, they started linking children with disabilities to education and medical care, tuition waivers, financial support. All of these changes meant that the children were getting better care, but also that the communities were being educated. These 493 pastors were helping to improve the mindset among 38,000 people in their communities towards people with disabilities. As a result, we estimated that 3,800 children with disabilities were experiencing improved health and well-being. We're continuing to track the impact of these programs so that we can enhance the workshop and the follow-up. We have carefully done pre- and post-surveys within the workshops and developed a tracking system so that we know what's happening after the workshops. We're also interviewing the beneficiaries themselves to see what their experience of improved health and well-being is and how they think the workshops and the religious leaders are improving their lives. The programs and the workshops are managed by our US and our Kenya directors, but implementation, project monitoring, and program design is happening from Kenya, from our staff, from our Kenyan board of directors, and from advisors from within the religious communities in Kenya. We are financed by a number of philanthropist churches and corporations in both Kenya and the US, and we've recently earned a grant for $50,000 to $150,000 from the UK government to support the rollout and the enhancing of these workshops, both the content and the monitoring and evaluation, so that they can be used more broadly both within and outside of Kenya. We've run 20 pastor workshops and 4 traditional healer workshops so far, and we're still developing the Muslim leader workshop. We would love your support in this project. We need more access to resources and experts in disability, in religion, and in advocacy. We need help with our content, to enhance the content of our workshops, to document it, to copyright it, and to have monitoring and evaluation tools that truly track the impact. We also would like partners to help pilot test these workshops and funders to help sustain this work. Thank you for considering this project.